Terrific. That could be yet another title for the entire report. Other comments from people? Great summaries, everybody.
A few comments. I was really encouraged by the whole set of sessions. Like many of you, I come from an economist tradition where, a couple people go up in front of the room, give talk, and then the whole rest of the room, their job is to kind of beat them up as much as possible. And I just did not get a sense that that was, what folks were trying to do here. And I think part of it is because I think people see what the bigger picture of what could happen here. I mean, I think if you had some sort of common standards and principles for benefit cost analysis, it could make that work much more usable by policymakers. Policymakers then might start actually demanding more of that kind of work done. They might pay for more research to be done. It might lead to program officials, instead of hiding from their evaluators, actually seeking them out to try to figure out how to make their programs better. There are just so many kind of vicious cycles that are kind of going on right now in this space that could turn into virtuous cycles if there was more commonality here. And I think early on in the sessions I mentioned, I think during the cost analysis session, that it felt like that was definitely a place where there could be some consensus, and then mentioned that that later session on research designs, I don't know if we're going to get there on that one, but I was extremely encouraged during that session too with, we stacked that panel to kind of be at loggerheads against each other, and to a certain extent, and there still was a lot of, consensus there. And so I think going forward, I don't think we want to constrain if there is a next group that looks at this. I just didn't see any places where it made sense to really constrain them very much in terms of where they might find consensus. They may not come to consensus in every single area, but I didn't see the need to constrain them in any particular ways. And so I just found the whole 2 days very encouraging.
So I think this was a wonderful panel, and I didn't realize that I didn't get the memo about being set up, but that's okay. I think that meant that I maybe played nice. One of the things I think is really exciting about this is I feel like we have a lot of the building blocks, and I think so there's a place to start on almost everything. I think we've got really good clearinghouses, which people have invested a lot in them. They were created for purposes other than what we're talking about here, but I think it would be relatively easy to adapt them and to bring them to create a common framework, and there is a federal interagency group working on that, and I think this group, if you went to a full consensus panel, you could plug into that. I think the work that Hank is doing and the cost framework and the work that Steve and his team have done, those two pieces I think would be, they're sort of close to ready to be married and built upon, and a lot of the building is not redoing the architecture of what they've done, but it's introducing the flexibility to allow these systems to address other questions, address other perspectives, be flexible to reusing the data. One of the things I think we have to be prepared for is there is no single benefit. I think we've heard again and again, there is no single benefit cost analysis. Any report that is done today will, for a particular client or purpose, will probably not be the same report that somebody would want 5 years from now, because the setting changes, the audience changes. So you'll probably want to repurpose the data, reuse the data with slightly different. So to have that kind of architecture, I think, is what we need. And it feels to me like this is just a terrific foundation to build on. So
I just wanted to emphasize 2 points that I don't know if we've talked as much about as maybe we might have liked to. The first was around the technological kind of advances that are being made in prevention, and how that can feed back into cost and benefit work. And so we talked a little bit about it in our panel around how we could capture cost more easily with lower burden. And I think that in the last panel, we started talking about all the administrative data opportunities for getting at benefits with a lot lower research burden. So I think in that context, as a possible next committee moves forward and talks about standards, we should talk about the standards in the context of what is the capacity of the research field, and that capacity to get high quality cost estimates, high quality benefit estimates is growing, and it's growing because of the field of prevention embracing technological solutions. So I think that's an important element and theme that I'd like to share. The other is we've talked a lot about building portfolios for policy of different types of programs, and kind of how do we allocate resources to those programs in the most efficient manner. But another side of the benefit cost work is building allocatively efficient programs themselves as we deconstruct them and look at the different components, the different strategies, and seek to build the most efficient program possible, not just the most efficient portfolio. And I think that optimization it's an essential theme that's growing within prevention science, and I think benefit cost work can really lead those opportunities there. And I think something that Hank said around linking costs to the actual kind of program activities, the actual strategies, is really an essential element of doing that, so that we can understand what resources need to be invested in what strategies, and how those strategies lead to specific outcomes, so that we can take those different strategies and combine them into the most optimal program possible. So, thanks.
Some of you know that the Center for Benefit Cost Analysis at the University of Washington has produced a set of principles and standards funded by MacArthur. I just say that I would hope that the committee that gets appointed, which I think is terrific, does look at that as a first step in going ahead, developing standards.
I don't know if I can speak, or is it just for them?
Of course you can.
My name is Nicole Bennett, and I'm with the Office of Adolescent Health at HHS, and I feel very fortunate to be dropped in here. It's really the crux of a lot of issues we're dealing with, some of which were spoken in terms of economic evaluation, but also in terms of implementation science and maintaining fidelity and program design and eval design, so all of those things. So just a quick background and then 2 questions for the board and moving forward. I'm kind of the program specialist part of policy that Jacqueline Jones mentioned, and then also part of what Kathy mentioned, the using evidence and part of the tiered program as we are implementing the Teen Pregnancy Prevention Initiative, which is a 2-tiered model. And we have an evaluation design where we're evaluating the programs that are on the list, but also the innovative programs that are kind of part of that smaller tier. And we wanted to do a cost analysis, and I was charged with making that happen. So I dove into the literature, read many of your papers, and found no consensus. So this is really helpful. Really brings the point home. So I wrote the statement of work anyways, kept it quite broad, and we awarded the contract, and we're moving forward. Part of it's going to be retrospective, but we're going to be capturing the programs as they're implementing. So one thing that I haven't heard anyone mention is the existing standards and guidelines that might be out there in other fields. I came across something called CHEERS, which I'm not sure if other people have heard of, and it has nothing to do with families, youth, public health per se, but and it's also more for reporting, but it's the Consolidated Health, I have it on my phone. The Consolidated Health Economic Evaluation Reporting Standards, and that was really helpful for me. And so I was wondering, my question is, I was wondering if there's going to be time moving forward. Obviously, you can't cover everything in this 2-day workshop, but time moving forward to look at pre-existing standards that might be in other fields. So that was kind of piggyback off of Dr. Richard Zerbe's comment. And then also wondering about the limitation to benefit cost analyses and cost benefit analyses. And I missed the morning session, but I heard that there was mention of cost effectiveness. And so if the standards and guidelines moving forward, if they need to be limited to benefit cost analyses.
I can speak to some of that. So the CHEERS was developed primarily keeping in mind cost effectiveness, the field of cost effectiveness analysis. Fortunately, actually, that standards themselves are evolving over time. I think this seminar was extremely useful for me because, the second panel to develop standards for cost effectiveness analysis has been recently convened. And the 20-member panel, I think me and two other folks are really pro including implementation as a part of economic evaluation, which cost effectiveness has not traditionally done, because we think they are extremely relevant for policymakers. And I think, I have enough support from this group to take back and kind of say that's, and so the CHEERS itself, I think, would evolve over time. And at some point, if the goal of these analyses to really inform policy, there has to be natural kind of convergence of some of these methods over time. The biggest difference is how you express benefits, whether it's in monetary term or some other term, but I think the methods should converge over time.
I was going to add just a couple of points I think that maybe we didn't spend as much time on, or I just wanted to make sure they were on the record. One is, I do think it came through in the discussion about cost analysis that cost analysis is a value in its own right, even if it doesn't lead to benefit cost analysis, and that that one thing I think that could come out of the workshop and a future panel would be emphasizing the importance of cost analysis as part of just good implementation and evaluation, and we should be doing that regardless, and then it's something that's there should a benefit cost analysis be warranted. Second of all, I agree. I agree with Max that really emphasizing the role that administrative data can play, both in short-term evaluation, but also so much of what we're talking about are programs where we want to know long-term impacts. And one of the things that often precludes those longer-term follow-ups is we think, oh, we've got to go find all these people and re-interview them and so on and so forth. But if you're given thought at the beginning to, I want to be able to link these people to their administrative records, and we've got the ability more and more to look at those linked data across different parts of the social service delivery system. So with planning, and again, this could be sort of part of the discussion of what a good evaluation design would look like, you're anticipating that ability to link to longer term outcomes just as a natural and lower cost way of doing longer term follow-up. And then a last point is, we've talked a bit about, this is a process in terms of program evaluation. You may be starting with a small scale demonstration project, then the next thing you try replication, so multiple sites, and eventually you're working towards scale up. And one of the questions in my mind is, when's the right time to do benefit cost analysis? Should we be doing it on that first demonstration evaluation, or do we need to see things mature maybe to a point where we've got more confidence that the results that we're seeing in an early phase is replicated later on. And I think it may also lead to some thoughts about ways of classifying benefit cost analysis when it is something associated with an early small scale demonstration, as opposed to, we've been able to see this and do an analysis on something that's replicated at a larger scale. So I just think that that's something else to potentially add to the agenda, to be thinking about how benefit cost analysis fits in with that process of program evaluation and that continuum. And I think, if we look at something like nurse-family partnership, I think one of the reasons why it's been so powerful is because it's had multiple trials and, where the benefit cost analysis sort of plugged into that process of them going from single site to multi-site, to replication.
So unfortunately, I didn't see you all talk the first day, and I want to make sure I'm not repeating, but you picked up on pay for success or social impact bonds, and I just wanted to say that what what's been really exciting about that work is that you have researchers in the field who are sitting there trying to turn the research tools into practical tools for policymakers. And I would hope that you reach out to the people who are doing that work. So MDRC, for instance, the guy Tim Rudd, who works for MDRC, who used to be in the back office, doing the benefit cost stuff, is now front and center because it's his analysis that drives the whole design in terms of looking at pulling the data out of the New York City budget systems, mining it, figuring out where the opportunities are, looking at the evidence. And similarly, in Harvard Kennedy School Social Impact Bond Lab, which is run under Jeff Liebman, but he's got the top graduate students in the country clamoring to come work for him, and he sends out teams who are going into state budget offices or city budget offices, mining the data, looking at the evidence, and then figuring out how to build evaluation designs that are essentially like real-time RCTs. I mean, using administrative data and being able to look at control and treatment groups as they go. So I think there's just a lot of really interesting work there and perhaps lessons that it would be a shame if that group were on one track developing practical tools that recognize all of the implementation challenges and the realities of getting data out of systems, and you all are developing something that's very theoretical. So I think there's a way of bringing it together.
So I just wanted to add something to what Gary said, and probably just what Kathy said, and clearly what Jacqueline did. When Jacqueline listed policymakers, they were really inclusive. And I want to sort of keep that in mind, that when we think about the reporting tool of who we're thinking about, that the audience is broad. So maybe we want to come to some consensus around who's the audience. So for this group of policymakers, it might look like this kind of data and spreadsheet, but then there might be other people who wouldn't benefit from looking at that, particularly the people who are the advocates out there who might be setting that agenda for policy. Maybe they need something different. So maybe we can think about that too as we come to this.
Yes. Hi there. My name is April. Hi, everyone. My name is April Tan, and coming from a background where, yes, it's been 15 years since I've been out of grad school, with practicing 7 years in the non-for-profit sector, particularly Boston University Medical Center and the Massachusetts Department of Public Health, and later than that, having about 7 years in the private sector, particularly with the social bonds or the social investing area, coming from the industry, particularly insurance and in quote-unquote the investment world, where we're doing private-public partnership in issuing these bonds and et cetera. I am thrilled to hear what the policymakers, the academia, and also perhaps there's students or participants that are sitting on the outside of the peripheral, hearing what's going on from being what's established and what is to come in the future in terms of using e-health as been in the e-health world for a little bit when that was just at the pioneer stage in New York City. And coming from a public health background, I truly appreciate learning what's established and what is present and what is to come. And I believe in using all of these tools to enhance cost-benefit analysis, and more importantly, to implementing to the participant level, meaning that the clients or the population that we're all trying to serve and enhance the value and the benefit and minimize. We all want to minimize costs, but enhance the benefit that served population that we're serving. Whatever program, whether it's prevention or intervention that we're supposed to serve. And above all, I wish that, I know in designs and trials, et cetera, I wonder how many of us ask the participant themselves what can be improved in the design. Because ultimately, the programs that are designed and funded, it's implemented on a population. And those who agree to be part of the study, obviously the success or failure, a lot of time depend on them. And a number of the studies I have done in the past, we didn't really ask the participant of the study, what can be changed or how it could be enhanced in the program. So, but now that I'm using my past experience, if you will, in the private sector, I wish there was more conversation and interaction between those who are doing the bonds, those who are making the policy, and the people that we're doing the policy for, financing it, more interaction with the participant, because ultimately it's their lives that we're affecting. So that's my thoughts.
So I want to echo what everybody has said about this being an incredible workshop. I know I learned a lot in the last 2 days. The things were on target. I also just want to get on a record that the whole idea of standards scares me. And, just thinking about the What Works Clearinghouse and those organizations, had a desire for standards that led to standards that exclude some really good research. And so just, we need to be cautious in moving forward about not coming up with those kinds of standards. You can have standards that are good or standards that codify bad, bad as well. So really moving more toward guidance or principles maybe is a word rather than standards. And two areas where I heard tension over the last couple of days where it might be hard to move forward are, one, just the whole idea of listening for the last 2 days, we realize how complicated it is to do benefit cost analyses, but policymakers want the simple answer. And how do you reconcile those two versions of things? And the second is there's a move in the work in looking at the effectiveness of programs to limit the number of outcomes that you look at, partly because of concerns about multiple comparisons, and yet there's also an interest in this group in measuring everything because making sure that we know everything that could be affected in a benefit cost perspective by the intervention and measuring it all, including it all. And so how do you reconcile that tension between the simplicity of focusing on the key outcomes and the importance of measuring everything?
I just wanted to think a little more about this notion of translating the work into a way that policymakers can understand. 'Cause I'm not sure that that's the take. I think it is really hard to give somebody a simple answer to a very complicated issue. But if you've had an ongoing conversation, then you have more time to dig deeper. And there's nothing that precludes folks working in this field from communicating with folks who are developing policy. So it doesn't have to be, we've done a report, and now here's the one-pager that we hope will not glaze you over and might help you in some way. So I think the notion of having some kind of real, a back and forth, a communication on an ongoing basis. What's going on in the world? What are you guys doing? What's happening in the world of policy? Could actually help policymakers understand this work and how complicated it is, but also help you understand what their issues are. Because ultimately there is something that needs to get done. What is that? What are we really trying to move forward on? I think the whole world of early childhood in particular has changed in the past 4 or 5 years. We talked about quality all the time. And so you had measures of the environment, measures of interaction. The policy that's being proposed at the federal level is not about quality. No, quality is a means. The end is to close this perceived achievement gap. And that's why this work is being done, to make sure that there are better outcomes across a broad range of domains for kids. So I'm just thinking that might be a mechanism to have ongoing communication with researchers and policymakers around these issues, and it's not hard to do at all. People do briefings all the time, and actually it leads to the kind of relationship building that I think gives a sense of trust and support to both sides.
So I think going to that same idea of an ongoing conversation, then I think standardization of reporting would help a lot, because just like Steve Oss was talking about over 20 years in Washington, I mean, over time, the legislators have learned how to read those reports and to look for them. So, you know, we all know how to read like a nutritional label on food. You know, we know what to look for and what it means and all that. And I think if there was kind of the equivalent of a nutritional label for cost-benefit analyses that was relatively simple, but included, you know, the important points, that it would be the start of that ongoing conversation.
Yeah, I was going to make this, I mean, same point. I mean, Steve's been allowed to have a 20-year conversation, you know, with his decision makers. And so they're able to think about this much more sophisticated way than, you know, than they probably were in years 1 and 2. And this, I think many of you know, I actually have a second job working for NBA basketball teams, doing analytics for them. And the first couple of years I was working for one of the teams, they would humor me by, you know, kind of paying attention to what I was doing, but I never got any sense that it affected their decision-making whatsoever. But over time, as they, you know, as they learned and got more used to what the, you know, the information that I was presenting to them, you know, my role changed quite dramatically, you know, to the point now where, I mean, like, a very large fraction of our decisions seem to correspond to with what I'm telling them to do. But it's a process, you know, and I think by having standards, by getting folks used to, you know, seeing this stuff, I think over time they're more and more they'll be able to make sense of it and figure out how they can use it in their decision making, and that's what, you know, Steve's been a lot, you know, able to do, and I think if you could build some sort of brand here that, you know, with standards and principles, I think that would allow policymakers, because right now what do? They get hit with, you know, one organization's telling them one thing, what the research says, another organization's telling them something else. They don't know how to make sense of it, so they throw their hands up in the air, and they either completely ignore it, or they just go find the folks that they, you know, like, and then, you know, and then talk about them on, you know, in some congressional speech or something like that. And so it's, you know, this would allow for, you know, potentially research to play a role, like CBO plays a role in doing a lot of, I mean, they're kind of seen as a, you know, an arbiter of a lot of things. You know, if you had standards like this, you know, you could potentially, you know, it would allow research to kind of penetrate, I think, in a way that it just doesn't now for most people.
I have a comment that I think builds from some of the things that Gary said, that gets at potential for risk in the field, credibility, and the utility of what we do. And I wanted to start by saying I think there's an important opportunity to educate people in the course of setting these standards. I think that because we're talking about money in tight budgetary times, people want to latch on to those numbers. They look for programs with a high benefit cost ratio. Maybe they should really be looking at net present value. That's not necessarily the right reason to choose a program, as Rebecca has talked about and others as well. Their choices should be informed not only by whether there's evidence that is cost beneficial, their capacity matters, how it fits with other programs matters that they're already doing, what population they're serving. I think it's just really important that those numbers, which are part of the equation, don't get magnified too much in importance around decision making. I also think that when I presented work, people have said, show me the money. You say it's going to produce this. I want to see that. And just because I found that in my analysis doesn't necessarily mean that you will, and that's another caution in this work. The other thing that I wanted to get at, I think this issue of uncertainty that we've discussed in a lot of different sessions in a lot of different ways is really, really important, and the leaning in the discussion seems to be measure more and include more in the analysis. And there's a lot of, I think, theoretical reason for that. But what it will also do, I think, is make those standard errors wider and that confidence interval around the bottom line wider. That may not ultimately be useful and it may not really capture the true beauty of a program. So I think there may be some dilution in measuring broadly. I think we have to be really careful here. So that's